for many more periodic academic programs that will be integrated with their daily routine, thus making our patient care the best specialty for the patients in critical care and operation room where smallest of the observation play a very important role in decision making and not missing any early signs of vital importance. I'm sure that very soon our intensivists and surgeons will also appreciate and acknowledge the knowledge and efforts towards the betterment of patient care. We acknowledge the efforts of our teams also for tirelessly adhering to the schedules, and on their behalf I assure you the learnings from the program will definitely make our services excellent and unprecedented in this part of the globe. I congratulate nursing faculties from Mayo Clinic, Miss Tholisa, Miss Bursiak April, Miss Matush Jennifer, Miss Babin Melissa, Miss Simili Kaila, and all the participants on the successful completion of this program that is truly aligning with our motto of the founders, more than healthcare, human care. Please enjoy our Lilavati hospitality and have a memorable time over here. Thank you.
Thank you, sir, for your insightful words and guidance.
Let's take a moment to relive this beautiful journey through a special video presentation showcasing the highlights of this training program. Can you please have the video on screen?
Of this progressive relationship. The collaboration between Lilavati Hospital and Mayo Clinic has been a transformative journey, opening doors to new learning opportunities and best practices in nursing care.
To share their insights and experience of this successful training program, we are honored to have Ms. April Bursick and Ms. Jennifer Matosh, Senior Nurse Advisors from Mayo Clinic, joining us virtually. So we are honored and we definitely would like to hear some insights on this occasion. Ma'am April Bursick and Ma'am Jennifer Matosh.
Thank you. Are you able to hear me okay?
Yes.
Are you able to hear okay?
Yes.
I'll go ahead and start. If I need to stop.
Yes, ma'am. Yes, ma'am. Ma'am, you're audible. Yes.
Well, what a journey we've been on. I mean, seeing that video just really warms my heart. I can't thank you all enough for all the hospitality that you have shown, our team and the team that we have there on site. When I look back on the last, months, I remember saying, my heart is in two places at one time. My heart was back home with my family and things that I needed to do here, but my heart was also back there, and I really feel that today with you. If I could just be across the globe right now and to be there in person, I would really love that, but just know my heart is in two spots at once. I think the word journey, you just mentioned what a journey, and I think that to me really says it all. This has been a journey for both of our teams. This is something that you've mentioned as well that we've never done at Mayo Clinic. We've never done a 10-day nursing excellence forum anywhere, not even just India, but anywhere. And I think, when we looked at planning this, we really thought, how are we going to make an impact? We want to make the greatest impact that we can. And we took a look at it from two angles. We wanted to work first with your nursing leaders, but we know we can't just work with leaders and then go away. In order to make the greatest impact, we have to work with both staff at the bedside, all the way up through to the leadership team. So when we started this journey, day one with Jennifer and I, the first 4 days were really focused on your leadership, growth mindset, moving from a fixed mindset. We talked about a lot of things. Your compassionate approach. How do you care for your teams and yourself? And it puts your motto first, human care. I would say those are not just soft skills. Those skills about leadership, about caring for, about connecting with, about leading with trust, impact patients. They impact your nursing retention rates. They will impact your KPIs, your patient satisfaction. So that's where we started this journey. And your leaders did a phenomenal job interacting with us. We had them doing a lot of acting up on the stage. We had a lot of laughs, but we had a lot of learning. I think at the end of the 4 days, everybody could articulate these 3 words: learn and grow. After the 4 days, we moved on to orientation, education, professional development, and then with our clinical experts who are with you today, really taking a deep dive into those clinical practices, looking at best practices. They spent a lot of time shadowing, asking lots of questions so that we could better understand your practice. And now, the work begins, right? So these 10 days have, come to a close, and I can really just say, please take time and reflect. We've learned a lot. There's been a lot going on in 10 days. We're probably filling your brains full of so much information, and likewise for our team. I know I've woken up in the middle of the night, many a nights thinking, oh, I gotta write that down. Or, oh, I wish I would have mentioned this when I was on site. We are all a work in progress, no matter where we are, here or there. When I left, it's not goodbye, it's just until we meet again. I'm gonna turn it over to Jennifer as well for a few words.
Thank you, April. You summed that up so beautifully, and I would agree with what April just said. My heart is in 2 places. In Lilavati, I can just picture all your beautiful smiling faces over there, but also here, halfway across the globe in Rochester, Minnesota. It's hard to believe we started this just 10 short days ago. It feels like over those 10 days we have grown together. We've had the opportunity to get to know each other and learn about each other's practices. We learned about your practices, we shared about our practice, and we grew together, which is really, as April said, we're all continuously growing and learning. It was really exciting to work on those leadership development portions with you, but also see, as Kayla and Melissa came to learn more about those best practices surrounding various KPIs, practices we use at Mayo Clinic that could be infused into the Lilavati practice, as well as have those more in-depth discussions about operating theater and critical care practices that you all can take back to your day-to-day practice. I would say now it's just 10 days later, but now we leave this engagement together as friends and not strangers. And you'll always have friends across the globe, and we'll all be in tandem working together to have the same mission, which is providing that human-centered, patient-focused care. And it'll be exciting to continue to stay in contact with you all throughout.
So we'll surely stay in touch until we meet again. Please have a huge round of applause again.